Said Wami, Executive Director of Needed Action for Community Care and Development, NACC, formerly called Namara as Coordinating Committee. It was established on 13th November 1996 as a community response to HIV and AIDS pandemic. MANGOCHI had a high prevalence rate, 17%. And one of the local leaders, by then Group Village Human Balakasi, who later promoted to Traditional Authority Bwananyambi, came up with the idea of saying, why can't we come up with a group of people that would be creating awareness so that in so doing we might prevent others from getting the virus, and also supporting others who had already infected. That's how we came to be established. Since then, we have been working and also growing in terms of programs and also in terms of coverage. Our vision is to create a healthy, resilient and prosperous community. So to achieve this, we have a number of programs that we are implementing. We have early childhood development program, we have educational program, we have livelihood, child protection, healthy and other programs that we are implementing. In early childhood development, what we do is that we are building the capacity of parents, the capacity of families and caregivers to meet the needs of their children. As you have seen the trainings that we have had just from 2 weeks ago, we are training caregivers. So the needs of these children include good nutrition, good health, security and safety, responsive care. In education, we are focusing on 3 objectives, main objectives. Number 1 is to improve equitable access to quality education for both boys and girls. Number 2, we want to improve retention, others call it persistency. And number 3, we want to improve pass rate. For us to achieve this, we work with school-based structures as well as community-based structures. We build their capacity to understand the barriers to education and also find solutions to these barriers.
Tele primary limbikitseni mpaka akafike sekondari, asalekele pompo akafike teshale level mpaka napa bwino wasashale asatukule Malawi.
Ine ndine Mufati Guvea, mphunzitsi wa pankumba pano komanso chair wa hostel committee.
Another program is a health program. In health, we are working in preventing and supporting HIV affected people. So we have support groups that we have initiated, and we have a total number of 1,800 people who are in various support groups, which are in a total of 59 support groups. Some of these people were bedridden, but through counseling and testing, they have access now to ARVs, and now they are clinically well, and now they are expert clients. They are supporting other people or fellow clients. And this, apart from HIV counseling and testing, we also conduct group therapy for them to understand new issues of nutrition, to understand issues of health, so that they can live positively and a good life. The other program is livelihood. In a livelihood, what we are trying is to improve household economic status. So we are providing training or livestock management training in goats, and we also provide pass-on goats. For example, a household will give 3 goats, but after reproducing, we ask the household to pay back 2 goats so that we can give to another household. And we have been doing that, and so far, since we started, we have reached up to over 400 people through the pass-on. And this is helping them to, when they sell, they buy food, they try to maintain their houses, they are able to support their children for education. For us to achieve this, we have what we call our own unique approaches. For example, for us to identify the challenges that children experience, maybe at school, maybe at home, or to find the challenges that parents are experiencing, we do what we call human-centered design approach to identify these issues. So we engage the families, we engage the children to understand the challenges that they are experiencing. So through this engagement, we are able to understand and we are able to hear the problems and the challenges, and together we are able also to identify the solutions to these problems. As NACC, we believe in working with the communities to identify the problems and identify the solutions together. We don't work for the community, but we work with the community. And also to achieve this, we also promote what we call community philanthropy, whereby after understanding the challenges, after working together to identify the solutions, we come together and we say, what can we contribute as a community? I'm really happy because in these initiatives, the communities are the ones who are leading the way. We are just following them. And wherever they may be struggling, we provide the capacity in terms of training. For example, in terms of organizing their communities, in terms of record keeping, in terms of providing educational counseling, we provided the trainings to the community leaders, and these are the ones who are now leading in these initiatives.